My name is Heidi Bockhold. I graduated from Life. I learned SOT in school, but I didn't gravitate towards SOT for a lot of different reasons. Nothing bad about SOT. But now I'm a co-owner of Options for Animals, which is the biggest animal chiropractic school in the world. We also have a school in Germany and one in England. Through that, Dr. Gene Thompson came in as one of our instructors and started playing around with more SOT, and then we started to see, well, what if CMRT and the fibers can be kind of simulated? Is there any correlation between the quadruped and the biped? So that's kind of where we've been heading, and we've done quite a few cases and not recorded all of them, unfortunately. And it's kind of hard to coordinate, to have a set study at this point because, both of us practice and we're all over the place. So we just kind of grab them as we can go. So I'm going to start with an equine case first. And again, we're doing this on quadrupeds. These aren't the only studies we've done. These two are kind of interesting. So again, we are looking at, do they have 7 fibers? And then does that correlate kind of spinally? And so that we started doing that. We've probably palpated more than 200 horses and dogs, I'm sure we've done. And we've also had other people that do SOT and work with fibers also palpate fibers to make sure that we're not misreading this. And there does seem to be 7 fibers in the quadruped. And the ones we've palpated have been horses, dogs, we've done some cats, and actually have had a couple guinea pigs that I've actually even felt fibers, which is a challenge. But we do believe that there are still 7 even on a guinea pig. We haven't treated any CMRT with that. So we've taken into consideration the comparative anatomy, and then obviously we've treated several animals. So I think all of you know what the occipital fibers are and what they do. And so we based all of our stuff on the human chart. So we started with this and then correlated it with the spinal levels. This is a very old picture, sorry. Okay, so then we had to start considering the differences in their anatomy. And comparative anatomy, they really are very similar to us. Obviously their organ systems are positioned slightly differently, although not that much. One of the differences is that they have 7 cervicals. An equine, the horse has 18 thoracics, and then the average horse has 6 lumbars and then 5 sacral segments. So that was the biggest kind of challenge to us, is to using the chart and going back to, is it going to correlate, and how are we going to do that? Because they have a different number of thoracics. So what we did is take the human chart and we added so that we were checking 1 segment above and 1 segment below the human chart. We started out as checking 2 segments above and 2 segments below, but we saw such a repeated pattern of it's generally right on or it's 1 segment off. So we discontinued the 2. We still check them every once in a while, but we find this much more significant, that it's really only 1. If it's going to be 1 segment, it's only going to be the 1. Okay. So the method of palpating the fibers is really, the same as a human. They're positioned very close to the same. It looks obviously different. The equine, this is a horse, and it has very high, kind of steep occipital ridge, but they're all located right where they're supposed to be. Palpating them is really not so difficult. Animals really, really like chiropractic. Horses in particular love chiropractic. In my regular clients, when I come in the barn, the horses are right up there ready to go. The interesting thing and kind of the fun part of treating animals is they are very motivated to feel better. They don't get a whole lot out of remaining ill. Survival encourages them to feel better. So I think we have that part of, that whole mental part of maybe I need to hang on to this illness for a while is not there. We found that they respond very quickly to adjusting, and this is just manual adjusting. They respond very quickly. And we've also found that you can over adjust them. So if you adjust them more than within about 8 to 10 days, you can make them temporarily ataxic. So for lack of a better word, their system seems to be a little bit more primitive than ours, probably a little bit purer than ours. So they're very accepting of anything that we are doing with them manually. A lot of people say, how can you treat animals? They can't talk to you. In a lot of ways, that's probably even better, because you can get the completely pure feedback with an animal. And once you get kind of used to them and you learn how to read the signs of an animal, it's really very obvious. Their facial expressions show pain or discomfort, or aggression or calmness. Also, their posture, splinting of the muscles is a real good one that we rely on, because a lot of animals are very stoic. They don't want to show that they're in pain. Again, it's a survival. But when you go in there and you palpate, that natural splinting in the area is very obvious. And then facial and vocal expression, not vocal with horses, facial with horses. With dogs, occasionally you'll have vocal expressions. So once you get used to it, it's very easy to kind of read an animal as well. So the first case that we did, or the case that I'm going to present, is AB. It's a 12-year-old Dutch warm blood, large breed horse, a mare, which is a female, and it does third level dressage. And dressage is one of the things that you see on the Olympics. A lot of people think it's kind of boring, but they have them in the ring and they kind of prance and move through. Very high level of training. Takes a long time to get a horse up into those levels. So AB was doing very well. Then this is a picture. This is the same horse, believe it or not. She began to have upper respiratory infections. So she would have shortness of breath. She would not be able to work as long, and she was depressed. Labored breathing. She would run fevers, high fevers up to 104. Their normal temperature is 101. So that was, a little bit on the concerning side. She would have a severe cough and thick nasal drainage. So, and originally it was like, okay, she has a cold. Then it went into, they checked for a sinus. They actually spent several $1,000s diagnosing and treating her for, ultimately they diagnosed her with chronic sinusitis. They treated her with multiple antibiotics, very high level of antibiotics, which obviously affected her intestinal tract. Also made her much more depressed. Again, after all this, they said, well, she has the chronic sinusitis. She got to the point where she no longer could perform based on respiration, really, and being depressed. Depressed in that she was very low energy, was not eating as well. She just, was obviously sick, and she had the drainage and everything. So they weren't even sure what to do with her. They were even considering euthanizing her, because she would not have been able to carry a foal. She had foals before, but she was just too compromised. So they were going to euthanize her. Not for the lack of trying. For what they did, they spent a lot of money and really tried to, and she would go short periods of improvement, and then she would go back down. I had been treating AB for probably a couple years. Then there was a period of time, because there was a divorce involved and everything, period of time when I did not see AB, and this is the period of time when she started getting really sick. So I had no idea that this was going on until I finally went back to see her. For those of you that don't know, this is Dr. Jean Thompson. She could not be here today. She's in Baltimore, Maryland. She couldn't make it. Okay. Is that 5 minutes for 15? Okay. I'm going to go real fast. Okay, so we checked her fibers related to this chart. We looked at the tender reflex points, maxilla and frontal area, and then C2 and sternal subluxation. She was very painful in her sternum as well. Okay, so we did our neutralization. Then we incorporated this. We're starting to use this, and to reference, this is a shot of underneath the belly of the horse. Hind limbs, and this would be the front limbs. And so we kind of use this, and then of course these numbers are up on the side of the horse as well. These are the entrance points. Very close to human, and they're working very well. Adjusted the T3, then we refer to a chart of anatomy. They have very large lung fields. When we started working with our colleagues and veterinarians that also do chiropractic, when we were asking them about this, they were laughing at us. They said, there's no way you can get to all those organs. You'll never be able to affect them because they have a very tough rib cage and musculature. We started manipulation. Jean is just demonstrating where we put our hands. There's no way we can stand this way because the horse initially, when you start to massage, initially the horse pulls away from you, and within like a minute they are leaning on you to make the force more. So you do have to push very hard, but the horse helps while you're doing this. So we did post-ganglionic, we manipulated the lung fields, we massaged the intercostal muscles, and we did a diaphragm release, which is very different than ours because their diaphragm is not at the edge of their rib cage, it's up about middle rib cage. Okay, the fiber dissolved. The reason why I have a star is because the fiber totally dissolved. And that's very, very consistent with the quadruped. It doesn't just kind of get mushy, it doesn't kind of go away, it totally dissolves. The reflex areas were significantly diminished. She was obviously still sore. 24 after the period of doing this, the owner was very upset with me because she became worse. She was much more depressed, refused to eat, restless, and she kept shaking, throwing her head down, which is a real strange behavior for a horse. I'm glad they didn't call me. So 30 hours post, she was still depressed, but she's throwing her head. Then she coughed, and just everything came out. The manager said like a bucket of mucus came out. And then she went and started eating. She was coughing for the next 12 hours. They finally put her outside because she didn't want to go out before, and she actually, ran off. So she's feeling much better. Within 5 days of the first treatment, she was starting to work again. So she was having very clear drainage, but nothing, real significant. Okay. 60 days later, the follow-up with her was that she had, she was still draining a little bit clear. The fiber did come back, so we repeated the treatment, and she responded again very, very well. I had the opportunity to continue to keep checking on her. The fiber came back one more time. I treated her, and then after that, it did not come back, and she continued to do very well until they sold her. And then I talked to the new owners, and they said she's doing very well. Back to competition. So it's been probably a year since we've treated her with CMRT. I don't have access to her anymore because she's out of the state. Okay. Next one, dog. All right, the comparative anatomy, the difference is 13 thoracics, 7 lumbars, and then they have 3 sacral segments. This is Barnaby, 12-year-old German Shepherd mix. He presented with hind limb stiffness and bilateral hip dysplasia. The closest thing you can relate that to is Leparthes, very shallow acetabulums, kind of common in the German Shepherd dog. Initially, he was treated by the veterinarian for the stiffness and the weakness in his back. They treated him with all these different modalities, and he responded quite well. He then started going to Dr. Gene Thompson because the veterinarian actually said, I'm not as good as Gene is. She's a chiropractor. You should go to Gene for your chiropractics, which started to happen. And then she would go back to doing laser and everything else with the vet. So he did very well being adjusted every 4 to 6 weeks, which is really typical of most quadrupeds. A year later, Barnaby began to have bowel incontinence. Had nothing, well, I shouldn't say that. It has really everything to do with what was going on his back end, obviously neurological. And so he started having that. The DVM decided, well, let's increase laser treatment and acupuncture with no response, no improvement with that. Gene Thompson was treating him, and with chiropractic, it didn't change anything. He was still having incontinence. He was doing this daily. At this point, she decided to go ahead and treat with OFT, and she checked the fibers, found line 7, or 7, line 2, nodule at L5, so she neutralized it. Again, this is the chart. This is the hind limbs of the dog, front limbs of the dog. So we kind of use these entrance points. She also adjusted to L5. The anatomy, we reviewed the anatomy and the location of the colon, and she did a counterclockwise massage on the colon. Again, you push in quite hard. You have to get in kind of deep. Not as much with the dog as the horse, but again, it's like, ow, this hurts. Okay, I understand. Go ahead and do it. And they will allow you to do it. They'll wince, but they will allow you to do that. So the owner said that the fecal incontinence decreased to only 8 times in a 20-day period. And then previously he was doing that every day, all right? She evaluated him 3 weeks later. She found fiber 6. So that was a little bit of a difference. There was kind of an overlay. And so she found the L4 this time. She decided to continue and treat with the colon rather than to move on. She treated exactly the same. That night, Barnaby had an accident, which is, again, not real unusual for animals. And then he decreased his incontinence. 2 months later, she had to reapply. He currently has incontinence approximately once every 3 weeks. So very, very, the reduction of it, quality of life for both him and the owner has really gone up. So we observed the close correlation between the biped and the quadruped, both with the fibers and also with the spinal levels, and certainly with the treatment. So based on that reaction, we read the animal, we get feedback from the owner, then we think this is definitely significant enough to continue to do this. We are continuing to build. We've taught some of this in Germany, so we're actually having people in Europe, give us feedback on their finding the fibers and what fibers correlated to the spine, not necessarily treating for that, okay? It's important that, people are trained not only in chiropractic but with animals, because, again, there are biomechanically is a significant differences in the two. And so there's schools and associations actually that certify in animal chiropractic. And so, further studies are planned, and if we have the time and the energy, we are going to put up studies. We're going to figure out, there's kind of common problems with animals, and so we'll group them together. And that's it. In Germany and one in England. Through that, Dr. Gene Thompson came in as one of our instructors and started playing around with more SOT, and then we started to see, well, what if CMRT and the fibers can be kind of simulated? Is there any correlation between the quadruped and the biped? So that's kind of where we've been heading, and we've done quite a few cases. My name is Heidi Bockhold. I'm a graduated from life. I learned SOT in school, but I didn't like gravitate towards SOT for a lot of different reasons. Nothing bad about SOT. But now I'm a co-owner of Options for Animals, which is the biggest animal chiropractic school in the world. We also have a school that, we're not misreading this, and there does seem to be 7 fibers in the quadruped. And the ones we've palpated have been horses, dogs, we've done some cats, and actually have had a couple guinea pigs that I've actually even felt fibers, which is a challenge. But we do believe that there are still 7 even on a guinea pig. We haven't treated any and not recorded all of them, unfortunately. And it's kind of hard to coordinate, to have a set study at this point because, both of us practice and we're all over the place. So we just kind of grab them as we can go. So I'm going to start with an equine case first. And again, we're doing this on quadrupeds. These aren't the only studies we've done. These 2 are kind of interesting. So again, we are looking at, do they have 7 fibers? And then does that correlate kind of spinally? And, so that we started doing that. We've probably palpated more than 200 horses and dogs, I'm sure we've done. And we've also had other people that do SOT and work with fibers also palpate fibers to make sure.